This is a treatment of the upper thoracic using the arc of tension. So before I install Alex, I want her buns to be at the border of the table, and the height of the table is going to be of importance, and we're going to see the different qualities of the treatment that we can get according to the height of the table. So initially we're going to make it easy for Alex, and if you can sit right here, Alex, and you're going to bring your buns right back. Okay, in this position, if Alex is much lower than me, when I'm going to treat her, I'm going to pull her up a little bit, and it's going to be more tractive than compressive. And if I go higher at that level, I'm going to be more compressive, usually, than tractive. Patient is going to have a flexion of the head to create a cephalad arc of tension. Because she's seated, we'll have a good lumbar lordosis, which create the caudal arc of tension. And I'm going to apply my sternum and bring her upper part backward to create a relaxation. The arc of tension is basically, we create a stiffness of a block of vertebrae to move him over another block of vertebrae, and we focus or we concentrate the Newton's thrust at the area which is relaxed. And this way, if we have good tension above and below, we do not have dispersion of the Newton force created by the adjustment. Patient has her head bent to create a cephalad arc of tension. She's seated, we have a caudal arc of tension. Now I'm going to put her hands behind her head, and as she does that, I'm going to bring my hands right above her hands. And as I do that, now I have the ability to pull upward. An important point needs to be made. The patient's head is maintained down, but the doctor does not press on the head down, just maintains it. So if the patient, you're not back, come back up a little bit, beautiful. Put back your, beautiful. And as she does that, so she's well positioned here, I'm going to stuck my sternum up the upper thoracic, bring her a little bit in segmental extension, and pull up. As I do that, it may work, or sometimes I may have a problem because the lower back is a little bit too slack and absorb my upward traction. So I'm going to get a roll and put the roll on the lumbar part of my patient. Bring back your hand. And now, as I am, squeeze your arms a little bit. And as I bring that patient up, suddenly we have increased the caudal arc of tension, and I'm able to have a much more focused force in the area that we relaxed. So look, as I treat that patient, I bring her posterior, which increases the lumbar lordosis, and above my contact, a little extension. This is a little extension over my contact to relax the area that I want to treat. Now, the two elbows, which are open like that, as I pull on them, it's a transverse arc of tension that is going to help me bring the cephalad arc of tension off the caudal arc of tension. So we have three arc of tension: cephalad, caudal, and transverse. Now I can increase the caudal, or the transverse arc of tension by asking her to pull her elbow a little bit together. And by doing that, basically, we have increased that transverse arc of tension, and I'm more specific with less shock absorption. And look, I create my segmental extension right there. Now, I spoke a little bit earlier about the possibility to lower the table much more. Let's take that out for now. And put your hand behind. And as I am here, and I just put her in extension here, I'm much more tractive. And many patients, I will not even need to have her elbow a little bit closer together. The reason being, there is much more traction. The breathing, because it's a very tractive technique, we tract, so it's more a separation using the gravity. So the breathing has less importance. Now, if I treat her and I'm much more compressive, then the breathing has more importance because the ribs is a shock absorber. If I press a little bit on her thorax to increase the thoracic pressure, to increase the transverse tension, then if she has air in her lungs, it's going to absorb part of that thrust when I go up like that. Sorry, I treated you. So it's why the breathing is more important when you're in compressive mode than you are when you are in distractive mode. So the interest of that techniques are multiple. One of them is if the patient is small, you can treat him, and if you have a horizontal left table, you can pretty much treat any patient. Small patient, if you're a big doctor or tall doctor. Big patient, if you are a small little female doctor. The adaptability of the technique makes it very, very attractive.